experience, Mrs. P. What area do you think the nurses can most improve upon with their communication skills?
Well, first and foremost, I think it's essential that nurses keep in mind how detrimental minimization can be. Telling someone that they will be okay when in fact they won't be is absolutely devastating for the patient. In addition to that, I believe that nurses just need to continually remind themselves that they are working for their patients and they should act accordingly during the time they spend with them.
Absolutely. Thank you, Mrs. P. She's totally staring at me.
Have a good afternoon, Mr. R. Hello, Mrs. P. How can I help you?
I am a very tolerant woman, but I am 68 years old and battling a very intense disease. I do not think that it is too much to ask for my nurse to give me his or her undivided attention during the few moments each day when I have concerns or questions. It has been 4 weeks since I have had a positive lung biopsy, and now I'm here preoperatively for a chest surgery, and I am sick of this poor standard that this hospital offers. I expected more from professional nurses.
I'm sorry that you are not getting what you expect, but I will make sure to take care of this for you. Hey, Briana, Erin, are you aware that Mrs. P is upset?
Why no, I was not.
Look at her. She's standing there looking at you guys. I spoke with Mrs. P during my round as supervisor. She's feeling ignored and minimized by both of you. As a nurse, it is your job to effectively listen to the patient as they are your number one priority, and communication is key to the patient's recovery. Before you leave today, I know it would mean the world to Mrs. P to hear you are a nurse who cares about the patient and take the time to effectively listen to her.
Okay, Kelsey, we'll make sure to do that.
Thank you.
Mrs. P. It was wrong of me to minimize your disease and not to anticipate your anxiety around it, as well as questions pertaining to it. I should have showed more concern and empathy about your feelings. I should have never called you sweetie or involved any aspects of my personal life in your care, because that is unacceptable and not very professional.
You have every right not to like the taste of food, especially with the way that chemotherapy affects your taste preferences. So let me know the next time you don't like a taste, and I'll actually work with you to try to make it taste better.
I didn't mean to invade your personal space by sitting on your bed, or putting you in a difficult situation by asking your opinion on my personal life. That is not your purpose here. It was rude of me to dismiss your reluctance towards physical therapy and to mock your capabilities by calling the exercises easy. I left early from your room while you were doing physical therapy and didn't allow enough time for you to ask questions. I was busy with other patients and thought that you were all set.
We didn't realize how long you were standing at the nursing station, and by all means, if we would have known how long you were there, we would have come to see what you needed at once. We're sincerely apologizing for not caring for you like we should. We did not communicate effectively or professionally, and for that we are sorry. We're nurses and we're here for you.
I understand that you are feeling anxiety and fear about your lung cancer. It is by no means easy. My personal life has no business concerning your health, and my main concern is of your well-being. Your questions and concerns will not go unanswered. Are there any that you have for me right now? Is there anything I can do for you? You have all my time that you need, and again, I apologize. And I hope that together we can work towards a comfortable healthcare environment and atmosphere.
Being a nurse involves being a part of a healthcare force team. This involves communicating with one another about the status, wants, and needs of the individual patient, and utilizing each nurse's best skills to provide the best care possible. A nurse's main priority is providing the best care possible for the patient, and in order to fulfill this obligation, nurses must communicate both with patients and their colleagues. When you see a coworker begin to minimize or ignore a patient, should you step up? How can you give your nursing colleague constructive criticism?
Well, I believe now that I should step up, but only in private. First by pointing out both the positive and negative parts, and then by pointing out areas that they could improve.
Excellent. If the nurse's main priority is the patient, doesn't that mean to provide the best care possible for the patient's well-being?
Yes, communicating effectively is essential to the patient's well-being.
Alright, so now, by asking only closed questions, a nurse minimizes and ignores her patient when they otherwise need to express themselves. Was this your intention, Briana, when you asked only closed questions?
No, my intention was not to ignore or minimize my patient. Sometimes closed questions are necessary for specific information, However, the best way to communicate is to use a combination of open, closed, and open focus questions.
Exactly. When it comes to disclosing personal information in the workplace, how can you tell a colleague they are releasing too much information in front of a patient?
Well, since that's very serious, I would ask my colleague to step out of the room immediately so that I could address my concerns. I would then point out that the focus should be on the patient, not on the colleague's personal life.
Thank you, ladies, for taking the time to talk with our news station today about nursing communication skills.
You're
Earlier
welcome.
today, I also interviewed with Kelsey, our nursing supervisor. Thank you for meeting with us today.
No problem.
I had a few questions about the incident that took place with Mrs. P. When you originally saw Mrs. P, you found her angrily staring at the nurse's station. How did you know to go over and talk to her?
As a supervising nurse, I look over all of my colleague nurses. I saw an upset patient in the middle of the medical surgical floor. I knew something was wrong, and the patient's anxiety stuck out in the middle of the hallway, and I knew something had to be done.
Did you at any point take the nurses aside to speak to them about their incorrect actions?
I felt as a nurse in charge that I should take each of them aside to talk. I didn't want to do it in public, so I took them privately so they wouldn't be embarrassed.
Was it hard for you to be assertive with the other nurses when correcting their incorrect communication skills?
No, it was not. As an experienced nurse, I knew exactly what had to be done. The DESC format helps nursing supervisors to act assertively and fairly. I used this strategy to clearly state the problem, express my feelings, and specify the course of action I wanted to see take place. Through clearly stating the problem, I was immediately able to express my feelings and specify the course of action I wanted to take place.
What other aspects did you implement to make sure that the nurses know how to correctly communicate with their patients next time?
I had implemented a communication training program for my colleagues. We were in a group where I had stated cases for them to think about. They all collaborated as a group about what had to be done the most effective way for this patient. They gave each other their own feedback and taught one another their own experiences.
Were you happy with the end result?
Definitely. I think the nurses did a fine job in speaking to Mrs. P when they went back into the room. I believe that communication training helped with the proper ending and allowed for Mrs. P to receive her feedback. Both the nurses and the patient ended up happy after the proper communication, and that is the best result a nurse could ask for.
Excellent. Thank you so much for meeting with us. And I think that goes to prove that a proper ending was felt indeed by all involved today. Back to you, Becca.
Wow, what an interesting perspective we have seen on the world of nursing today. I hope all you professional healthcare providers were paying attention to the way these nurses improve their communication skills. Well, that about wraps up this morning's segment, but please stay tuned as Dr. Frank Rogers brings you a primetime special on microbiology and human disease at 9:40. Stay classy, Durham.